I'm going to be honest with you guys, this has been one of the more difficult shifts. It's been pretty tough actually. It feels like we've had a lot thrown at us today. Hello everyone and welcome back to my YouTube, welcome back to my channel, welcome to another video. In this video I'm going to be showing a bit more insight into the Frontline, into A&E, into what's going on. I'm going to talk a little bit today about some of the cases we're seeing, some of the examples of cases of coronavirus that we're seeing on the front line, how they kind of present, what the typical findings are, and kind of a little bit into how we manage these patients. So probably a bit more in depth than what I've done before. Of course, respecting patient confidentiality, keeping all those kind of details anonymous, but trying to give you a real insight into what's going on, what we're seeing, how we're managing it, and kind of what we really expect when a patient comes in, because that's a real kind of unique perspective about this, and we are learning every day. It is an ever evolving situation, and as time goes on we'll only know more and more about how to kind of manage the condition. We'll also talk a little bit about what future treatments there might be, what might be coming in the pipeline. I know there's a few medications that are being talked about in America that they're considering using, so let's talk about those too. And also let's really have a chat about whether we think on the front line that intensive care units can cope. Can they cope with what's going on with this, the new Nightingale Centre being made, the NEC is being used in Birmingham, and also in Wales they're looking at using the Principality Stadium to house more intensive care beds. So will they cope? Do we have enough beds? Do we have enough staff? Let's have a chat and find out more. So guys, I'm joined by Dr. Taylor now. She's one of the ED registrars, A&E registrars here, who's kindly agreed to kind of share her input and share her kind of experience of coronavirus so far. Obviously you've been working on the front line for quite some time.
Yeah.
So if you're a registrar, you've done intensive care, you've done anaesthetics, you've done medicine, you've done a lot of experience basically. So over the last few months, how have you experienced and what do you think of like the development of coronavirus?
I think it's just got busier in the last couple of weeks.
Yeah.
Mainly, it's been it all kind of felt like this mythical thing only like about a month ago, and now it's like actually probably we're definitely seeing more cases and things.
It's become more like real, hasn't it? Because like for a while we were obviously like waiting, like is this going to be that bad? And all of a sudden it has got a lot more kind of serious, really. Yeah.
So I think lots of people are actually being sort of seen and more unwell, obviously, than before, and now it's not really to do with travel, it's just literally it's everywhere.
So it's already been quite a busy day today. We've seen quite a lot of patients. We've had patients intubated in the department. I mean, how many patients are being intubated at the moment in this hospital?
Probably, I would say, maybe like 4 or 5 every 24 hours at the moment.
Which is quite a lot of people. That's quite a lot, isn't it? Because of course you get other people are unwell for other reasons as well. And so we're seeing other patients like we normally would, and this, which puts pressure on, doesn't it?
Yeah, so I think the pressure's definitely gone up, and obviously the way the department's run is obviously changing quite a lot. Yeah. Like every day, basically.
And what's your, putting your like kind of prediction cap on, what do you think is going to happen? Have we hit the peak yet, do you think?
I don't think we've hit the peak yet. I think we've got a little bit longer to go, and I would say I'm hoping that the peak's in the next couple of weeks.
Yeah. Everyone wants to kind of get to the peak so we know. It's almost like you want to know how bad it is and over it and you get better. What about, and I think we should touch upon this, I mean there's a lot of talk about intensive care beds. Obviously NHS Nightingale is getting open. We've got the NEC up in the north, and also in Wales they're opening a centre. Will we cope from an intensive care perspective?
I'm hoping so. I think like Formula One are doing quite a good job at making some like new ventilators and things, and I think actually the flow of patients is that we're managing to obviously get them into ITU and then out of ITU.
Because the challenge is, of course, it's not just like when people get admitted to intensive care, it's about how long they're there and how long it takes to get to the point that they're well enough to being stepped down. That's a big point, isn't it? So these patients are spending potentially 10 days, 2 weeks on intensive care, aren't they?
Yeah, which I think with the opening of the Excel Centre, I think that will help with that as well.
And from a personal perspective, how are you feeling at the moment? Are you kind of, your morale, how's your morale? Are you feeling?
I feel like it's more like anticipation. It feels a little bit like the calm before the storm.
Yeah.
I feel
even though it's not that calm.
It's not been very calm today.
Last week
was, it felt like a little bit, that we're
bit
all
better.
in anticipation, aren't we?
Because it's felt like it's been getting busier and busier, and then all of a sudden, like today has been busy and it's been stressful. It's hard some days. A&E is an amazing job, but some days like today, I feel like everyone's just been so sick. I feel like today everyone's been so sick, which is stressful.
You can't get them home as well, which I think is more difficult.
And we laugh about it because you've got to be a bit kind of you've got to. As medics, we've got to try and smile or you cry kind of thing. But it's been a busy day. But thank you so much for joining me and having your input. By the way, people are going to be asking why are the coats in the background. This is actually the registrar's room, and look how good they are. You come into the room, you come into the room, and you wash your hands straight away. So that's very good. It's a very unexciting room because it's the NHS.
It's nothing exciting.
Thank you so much. We'll get on with our shift. I'm going to be honest with you guys. This has been one of the more difficult shifts. It's been pretty tough actually. It feels like we've had a lot thrown at us today. Had a guy in his 40s coming in in cardiac arrest from the community. We've had a guy in his 60s who was otherwise pretty fit and well coming in with a suspected coronavirus. We had to intubate him. Not sure how he's going to do, as well as some elderly people as well, very, very unwell. A lot of people, I've seen a lot of coronavirus today. It's been pretty challenging. Got a couple of hours left of the shift. I just managed to stop and have something to eat, but days like today are tough. Days like this is when you really feel it. Cardiac arrest is always horrible. As a prolonged cardiac arrest, managed to intubate the patient. A lot of members of different teams, intensive care, anaesthetics, us in ED as well. But yeah, it's really tough. We're talking about whether intensive care units can cope. It depends how many patients we get, and we only have a limited number of beds, limited amount of capacity, limited number of staff. So it's really hard when you've got so many patients coming in. If you think how much input they require as well. If you've got a patient that comes in that needs intubation, they're going to need members of the ED team, so the A&E team, resus nurses. They're going to need anaesthetic input, intensive care input, and if you've got multiple of those patients, especially even at the same time potentially, very difficult. So as this crisis unfolds, I think the pressure is just going to increase on departments. I think they will cope, but there's going to be a lot of pressure. It's going to need everything we've got to do this. I think it's so important they actually do open up NHS Nightingale, that the neck is used in the NEC up in Birmingham is utilised, as well as units in Wales as well, because we need more capacity. We need more places to put these patients. I don't want to be in a situation in hospital where we haven't got enough beds to put these patients in, and that would be awful. So I am a positive person, you know that, and I always put out positive vibes. I'll catch up with you guys a little bit, but yeah, not easy. Hey guys, so I'm back home after my shift now. Been able to take a shower and kind of cool off after everything that's happened. You could probably see in the moment there that I had quite a hard shift. You start really positive and sometimes things don't go very well in A&E. That's the reality of life, and what we're seeing on the front line can be really challenging. And I'm sorry if that kind of is distressing to anyone, but I think it's best to be honest. I'm just trying to show you a real insight of kind of the highs, the lows, and really how we're feeling on the front line. And at times it's bad. I'd rather tell you the truth than try and pretend and sugarcoat stuff. As I've said all along, 90% of people will have mild to moderate illness, but we're still seeing patients who are really unwell. Seeing someone who was well 4 days ago, who's 6 years old and was going on about their life and is now in a very different situation is tough. It's really hard. What I will say, in the vast majority of cases we're winning. Even those that are really unwell, we're getting them there. And we are having deaths, as you can see from the figures. They are continuing to rise. We kind of are expecting that. But the measures we're taking in social distancing and isolation will help. There is another side of the story. There's a lot of patients I'm seeing in the department who are coming in with symptoms of coronavirus who actually are requiring not much help from us at all. We look for certain patterns. Often we see that certain white cell count markers go down, so lymphocytes are often low. We can see sometimes that there's a protein called a C-reactive protein that's high. It can be raised for a lot of different reasons. We're doing chest x-rays to look for evidence of coronavirus there. And then, of course, making a decision based on how the patient's doing. What are their oxygen levels? How are they coping? What's their background? Will they go home safely? And a lot of them are going home, actually. And that's really important to say as well. And managing this back at home, even the ones we're seeing in A&E, some of them are actually going home directly to manage the condition. For a lot of patients that need to come into this department, we are starting on antibiotics, not because the antibiotics work against the virus, but sometimes there's opportunistic infections that take advantage of a weakened immune system, and therefore we give the antibiotics to protect against them. We make sure that we monitor the patient, keep a close eye on them. We give them oxygen therapy where they need oxygen. So for a lot of patients, that's all they need is some oxygen therapy, some antibiotics and monitoring for a few days, and they're able to go home safely. So for some patients, we have to consider other options. So one of the things sometimes we have to do is put a mask over their mouth and blow air into the lung to help with the work of breathing, get the carbon dioxide out and get the oxygen in. That's sometimes needed. You might have seen on the news actually some of the Formula 1 teams and other places are working on these specialist masks that refilter the particles and are also more comfortable for the patient. They actually have hoods on them as well as the mask. So really like amazing stuff. So it's great that companies like that are doing their bit to try and help. Other patients might need intubation, like I mentioned about my earlier cases, that they might need intubation. It might be to the point where we have to take over their work and breathing to manage the oxygenation of their bodies and basically look after them in a state of induced coma. So if you have to intubate someone, we give them medications that essentially puts them to sleep and lets us take over their lungs, their work of breathing, and an anaesthetist will pass down a tube into the airway, into the lung, which then allows us to take over the work of breathing. Often intubation takes place in the A&E department, and then the patient will be transferred to the intensive care unit. On the intensive care unit, that's where the patient will be further managed by an intensive care team for as long as they need to be there. It's very difficult to say how long a patient will be there. It could be days, it could be weeks. So I know a lot of you have probably seen on the news about chloroquines as anti-malarial medication that Trump has claimed as a wonder treatment for coronavirus. So chloroquine is a very old medication. In basics, it works on anti-inflammatory, it has anti-inflammatory properties, and therefore is useful in things like malaria. What we do know is that there are side effects of chloroquine, and actually, because of the statement made by certain individuals saying that it's really effective, a lot of people have been buying this drug, taking it without guidance, and then having side effects, of which there are a number, and actually some people making themselves really unwell and hospitalised even by taking the medication. So is there evidence? The simple answer is no. The WHO have said there's no evidence at the moment to support really the claim. That's not to say that there might not appear to be some evidence at some point, but we don't have anything, from what we've seen so far or in clinical trials to support that. And it's really, really important we just don't jump the gun, because you can do more harm than good sometimes. You might be giving something because you think it's helping and cause an opposite effect. So it is really important we don't just throw medications at it, that we do things in a measured way, and that we use science and evidence to drive what we're doing rather than hope. I want to talk briefly also about intensive care and how that will cope. You've seen me talking to Dr. Taylor earlier about this. I think our intensive care unit's doing really well. Everyone's working very, very hard, and we're seeing more ventilators arriving, which is really, really important. Of course, NHS at Nightingale has just been opened, which can take up to 4,000 patients. It's a huge number of patients. If it does work and we can open this facility fully and we can staff it, it'll make a huge difference and help us, because it's not just the ventilators. If you think you've got to have the beds, the specialist beds, the equipment that goes along with that, all the medications that goes along with that. You need the nursing staff, one-to-one nursing staff. You need chest physios to help with the patient. You need pharmacists there. It's a huge team. It's not just the doctors as well. So I really hope they're able to staff that, because that will make a huge difference. Personally, I think our department's doing really well, intensive care unit, and the team there are fantastic, and they're doing their absolute best, working round the clock to look after the patients and make sure that our capacity isn't met. I hope this video has been useful. I'm sorry if it's a little bit sad at certain points, but as I said, I'd rather be honest with you. I always say that on my Instagram, everything I do, I'm honest with you what's going on, and I think that's better. Let's be positive, we will get through this. I'm really confident in that, and I've got faith in the NHS. Take care, everyone. I hope this has been interesting. There's more videos to come. Once this is all done, I'm going to continue doing videos around health, and we're going to talk about how to stay fit and healthy in body and mind, so that we're in the best possible shape, say something like this happens again. I think it's really important we all take a look at our health and how we take care of ourselves. So I'm going to be doing a lot more content on that as well soon. Thank you everyone for watching. Take care, and I hope this video has been useful. Please do comment, let me know your thoughts, and subscribe to the channel too. Thank you.